welcome to the University of Pennsylvania Salivary Gland Center. We evaluate and treat a number of different diseases of the salivary glands. The following video is designed to help you understand blockages of the salivary ducts and the causes of your pain and swelling. In your case, this is not related to any kind of cancer, but it could lead to infection. The symptoms of pain and swelling that you have might well be improved by using the techniques in this video, both now and after surgery, if surgery is recommended for stones or other blockages.
The salivary glands produce saliva and empty into your mouth through a system of ducts. When something causes a blockage in these ducts, a buildup of saliva, inflammation, or sometimes infection can develop behind the blockage. This can cause swelling, pain, dry mouth, among some other symptoms as well. There are two major salivary glands in your head and neck region that are affected by obstruction. The first is the parotid gland, which sits in front of the ear and extends slightly below and behind the ear. So that would be in this region right here. You have a parotid gland on this side as well as on the other side as well. The parotid gland is usually obstructed by narrowings called strictures in the ducts. So a regular sized duct can become very narrow and then cause blockage happening behind it. There can also be salivary stones that develop in your ducts and cause a similar blockage as well. So if you have swelling or pain in these two regions on your face, that could be a sign of obstruction of your parotid glands. The next set of glands that are typically affected by obstruction are the submandibular glands. These glands sit under the jaw on both sides and are most commonly obstructed by salivary stones. So if you have swelling or pain in either of these two regions, that may be a sign of obstruction of the submandibular glands. So as described on the Salivary Gland Center website, there are also other diseases other than stones and strictures that can cause obstruction of the salivary glands. These include Sjogren's syndrome or radioactive iodine-induced sialadenitis. In this video, we would like to demonstrate the salivary gland massage, which is something that can be done both in the doctor's office as well as on your own at home or by someone else at home. The massage is crucial to helping the flow of saliva through the salivary ducts, which can avoid that obstruction and the backup that can develop behind it. This can prevent the symptoms of pain and swelling or provide relief from those symptoms when you do develop them. This massage should be done regularly, about 8 times a day. A recommended schedule would be once in the morning upon waking up, then before and after each meal, and once before going to bed at night. This will help to maintain flow throughout the day and prevent any blocks from developing. You can also perform this massage when you have any ongoing symptoms of pain or swelling, and it will typically be recommended after you have any sort of salivary gland surgery. So we'll start first with the parotid gland massage. You can use 2 or 3 fingers, and you want to start below and behind the ear and push and move forward to that region of the salivary gland that we discussed. So when doing this, you may feel saliva coming in that region on the inside of your cheek, and that's completely normal. And sometimes you can experience a sour taste, may feel some thickness in your saliva, or notice that the saliva is slightly cloudy. That's normal, and you can still continue on with the massage. That may just indicate that there has been an obstruction for a while. You can also enhance this massage by massaging along the inside of your cheek with one finger as well, while you're doing the outer massage. So that would look like this. Similarly, a massage of the submandibular glands can be done. So you can take 2 to 3 fingers and start in the region of the submandibular glands, and you can start in the back and massage forward. You can also use one finger inside the mouth to assist with this massage. and you should be pointing the finger downwards and following the outside fingers with the inside finger. When doing the submandibular gland massage, you may notice saliva coming from beneath the tongue. That is normal, and that is usually where the submandibular gland empties its saliva. You may also experience a sour taste in your mouth while doing the massage and notice that the saliva is slightly thick or cloudy. That is okay, and you can continue on with your massage. So these are the salivary gland massages that can be done at home. This can also be done for you by someone else at home who can do these same techniques that have been demonstrated. When you come to the Salivary Gland Center at the University of Pennsylvania, this is likely something that will also be done for you. This will help with the obstruction and also allow a look at the type of saliva that's coming out to see if there are any signs of infection or long-standing obstruction. Along with these massages, other things that can be done at home to manage these symptoms and stimulate flow through the glands and their ducts are drinking lots of water, specifically water with lemon, and having some sour candy. These two things can really stimulate the flow of saliva. With that, we thank you for watching and conclude this informational video. We encourage you to visit the Salivary Gland Center website to learn more about the salivary gland diseases and other treatment options.